Recently that he was very frustrated about his emergency department experience. He has a condition called atrial fibrillation, and it comes and goes, but at times it can be persistent and fast. And when the medication doesn't work, he sometimes will get what's called cardioversion, which is to apply electricity, usually done in the emergency department or by a cardiologist in a medical setting, to reset the heart rhythm. And it doesn't always work, and he's frustrated and wanted to know why this is the case. And so I wanted to share in this video just a few points about that topic of itself. It's a very, very common arrhythmia, and it can cause unpleasant symptoms, and it is a huge risk factor for stroke. So it's not something to be ignored. Fortunately, many patients can tolerate it and live with it long term, but for those that are getting cardioverted, getting electrical shock applied to the chest wall, this is based on a number of factors, whether or not it'll be successful, and that is how long has it been going on. If it's been less than a few months, it's much more likely that the electricity applied is actually going to work. And if you look at the statistics, it shows that patients that have had AFib less than 6 months had a 2.2 times higher chance of having a successful cardioversion compared to those who've been in AFib for a longer period of time. So the caveat here is not to ignore it. If this is something that affects you, you don't have to necessarily live with it and let it run its course. There are things that can be done to mitigate that and to treat it. The next factor is patient weight. Patients who are under 80 kilograms, a kilogram is 2.2 pounds, this is an independent factor for success. So lighter patients tend to have more success, and one of the theories is that the chest cavity is smaller, some of the body fat and habitus is smaller, and the impedance when the electrical current is applied to the chest is much less. So the statistics show that those that are under 80 kilograms had a 2.3 higher chance of improved odds of success compared to patients that weigh more than that. The next is the atrial size, and that's the top chamber of the heart. Particularly a smaller right atrium has a much likely higher chance of success. You may not know all these metrics and these factors, but if you've had an echo done, which hopefully you have, if you have AFib, that this data is there in your MyChart or whatever medical record that your particular healthcare system allows you access to. And then the critical factor is cardioversion technique, and this is something that is taught, at least it was taught to me when I was doing emergency medicine residency. Spent quite a bit of time rotating with the cardiologists and the electrophysiologists, and this is something that just became bread and butter in the emergency department. And so the reality is that emergency departments in the United States and across the world are staffed by a variety of different levels of trained providers. Some of these are PAs or nurse practitioners, others are physicians, obviously, and hopefully the person that you're seeing has qualifications in this particular procedure and hopefully is board certified in emergency medicine, just tooting our own horn essentially. But the reality is that the technique matters, and the use of biphasic electricity, which is just a type of waveform that most of the newer devices utilize, it has a much likely higher chance of success compared to what's the old school monophasic waveform. I don't want to get into the physics of electricity, but it's just known. And then also the next factor is delivering just a higher energy shock. I've had my heart cardioverted several times, and one of the scenarios was a family practice doc who was new to the ED and was just uncomfortable and wanted to start with a lower amount of electricity. And I'm like, let's just go for the gusto. Let's get it done. Hopefully get it done on the first try. And so what the statistics show that a higher level, which is greater than 200 joules, increases the chance of success 1.62 times compared to starting slow and low and escalating it. And the old teachings used to be starting at like 50 and then going up to 100. Just starting at 200 or more has really been proven to be much more likely to deliver the success that not only you want as a healthcare provider, but your patient certainly wants to leave the emergency department back in a normal sinus rhythm and to be out of AFib. And then applying pressure. You kind of stick pads on the chest. A lot of people will do that. Old school cardiologists taught us that a little bit of pressure, like maybe 25 pounds of pressure, can go a long way to improve the delivery of the shock. And this has actually been borne out in the data that it's a 2.19 times higher chance of success by applying some manual pressure. I'm not going to go into the techniques of this for this video, but it's just something to keep in mind. And then the medications. There are a variety of medications that are used for atrial fibrillation to not only control the rate, but also control the speed and control the rhythm. And the chance that the success of cardioversion would be higher would be 7 times more so if the patient's on a beta blocker, and 3.6 times more so if they are on a calcium channel blocker. Diltiazem over verapamil, those are two of the more common ones. So I just wanted to spell this out. This might be a little bit deep in terms of some of the medical jargon here, but atrial fibrillation is a very common problem. I'm going to get into some of the more specifics about why if this is something you're concerned about, that you should have this properly evaluated. Fortunately, the Apple Watch algorithm has improved its ability to detect AFib, and there are a variety of other devices that I've covered in some other videos that are beneficial for those that are really into the quantified self movement and want to be a little bit more proactive about determining what's going on inside their own bodies. Hope you found that helpful. Cheers.